And then, well, I'm going live on YouTube.
Hello, everybody.
I'm going to go live here on Instagram.
Flatlined about 3 times, and I was 8 years old. It was around the time
Hi, everyone.
both my lungs had collapsed, and I needed a ventilator to breathe. I was going to have like a 20% chance.
I hear it. Do you hear something?
I gotta turn my iPad off.
Hello. Happy Friday. Welcome to Ask the Experts. We have Dr. Q here with us. Hi, Weebreeze. So happy to see you guys on. Feel free to go ahead and start putting your questions, or at least just shout out where you're from. Love to see all the places you guys are. Wish I was there. And we're waiting for Dr. Q. Let me see here. Hi, Demi Law. Hi, it's Martha.
Yeah, I'm waiting for it to come up on the Sickle Cell 101 Instagram, the request to be, I haven't seen it.
So we're on, if you just scroll down and update your feed.
You know what I need to do? You're right. I need to refresh. That's what I need to do. There, I got it.
We have, good morning, Ronnie Alva. We have New Jersey. We have South Carolina. We have Alabama. We have Ghana.
There we go.
Dubai. Awesome. Can I come visit you in Dubai? Because that's on my list. That's on my list. I'm not even joking. And it's sickle cell safe because, y'all know about sickle cell in Dubai. Hello from Fort Lauderdale.
So you should have got a request at some point there from me.
I also want to visit Ghana too. Just to really see if your guys' jollof rice is better than ours in Nigeria. So I'm going there to start trouble. Tennessee, New Jersey, Miami. There we go.
Yeah.
Hi, guys. Dubai is on your list too. Let's put together a travel group or something. Oh my gosh.
We have a lot of people on today that are from the international group.
Aisha, I am going to take you up on that offer. I am going to hit you up. If I book the ticket to Dubai, you will hear from me. Well, happy Friday, everybody. So happy to have you guys on live. Feel free to ask any questions or go ahead and start asking questions. Hey from Cali. I will go ahead and get us started on a question that we received via the story. And I think this is an important question. So, how does sickle cell progress as one gets older?
Well, it depends on, nowadays there are a lot of, besides gene therapy and bone marrow transplant, there are a lot of therapies like hydroxyurea, voxelotor, etc. So back in the day, before we've had hydroxyurea for a long time, but basically sickle cell disease is a chronic illness. And like Cassandra says a lot, is even when you're sitting and you feel fine, you're still having sickle. So the process is going on all the time. And what I used to tell my people I took care of was, you need to do something. Everybody who has, especially if a SS, SC, or some kind of sickle diagnosis that causes problems, you need to be on some kind of therapy. You can't, and start it early. if you're a parent, start it as early as your primary care physician will start. So if you start hydroxyurea, say when you're, I don't know, 5 or 6 or before that, the progression of your disease is going to be different than what it would be if you didn't have that medication. So, but the way the disease progresses is it's an accumulation of chronic complications. So you have probably one of the most common would be avascular necrosis of the hips, and you get a hip replacement, or maybe your shoulders, you can have your knees. Joints that use a lot can have problems. So that's probably one of the things that comes up early. The other thing is, depending on how often you have acute chest syndrome, how someone just said leg ulcers. Leg ulcers are really hard to treat. They're a comorbidity associated with other things. But the other thing that I'm just flashed in my head is if you're transfused and you have iron overload and you're not chelating appropriately, that's going to change the course of your disease. I mean, Cassandra and I know people who are in their 60s and 70s with SS. So it's different for everybody, but generally the things that are, you can have a pulmonary disease, you can have restrictive pulmonary disease. If you have asthma, that really needs to be treated because that will compound your respiratory disease. You can, over time, people historically with sickle cell disease tended to have some cerebral cognitive problems that are kind of ill-defined. But that's the course, is you continue, if you aren't on treatment, you continue accumulating these chronic problems that eventually can be really serious.
So in other words, it sounds like you have to be active, you have to be proactive with your health with sickle cell.
Absolutely.
You cannot kind of just, so the way I know some people, they kind of just wait for crisis to happen, right? And that's when they think something is bad or something health-wise is happening with sickle cell. But like Dr. Q says, I always say, I'm sickling right now. Like, and I'm good. You know, I'm not in a pain crisis right now, but I'm still sickling. That damage is still happening as I'm speaking to you, because those blood cells are still sickling. They're still not very good at carrying the oxygen. They're still not delivering oxygen to certain parts of the body because, you know, of the sickling and all of that. So that damage adds up over time. And, you know, with this question, you know, how does sickle cell progress as one gets older? So just, we know generally people who age tend to get more health conditions because your body, it's undergone wear and tear. With sickle cell, it undergoes that wear and tear, but then in addition with sickle cell, that additional damage. And so from what I'm understanding with Dr. Q is taking some of these therapies that help slow down that damage is what is best. And I will just share quickly, I take hydroxyurea. I didn't start taking hydroxyurea because I wanted to be in less pain. I started taking it for organ preservation, so slowing down that damage. So if I was still going to be in pain, if I was still going to have like 5-6 crises on hydroxyurea, I was still going to take it because it's still offering that organ protection in particular. And so that's the name of the game, is slowing down the progression of the disease. And there's a lot of ways to do this. It really boils down to you as a person, right? And you and your lifestyle as well. y'all probably saw that video with Miss Pat who turned 80. She has SS. Like, I feel like mental health, no, it's not, I feel like I know mental health plays a big role in this too. Like, she is so positive all the time. And, she's made it to 80. And of course, I believe she told me she was on hydroxyurea as well. And, some of these disease modifying, she tries to exercise, she tries to eat well. I believe she cooks all the time, which I don't. So that's something I'm working on. But, there are all these contributing factors to it. Disease modifying therapies, lifestyle, your mental health, all of that, which contribute to how long you will live and what your disease will look like as you get older. So, it's a multi-pronged approach. You have to tackle it in multiple ways. Having a community is also part of it too. Just having someone who understands that pain or someone who understands what you're going through helps validate, because sometimes you'd be thinking you're going crazy. Like, you'd be like, am I really this sick all the time? Or am I really this like tired all the time? And yes, the answer is yes. Like, don't ever feel guilty about feeling tired. Don't ever feel guilty about being in pain, because that is what sickle cell disease is. Like, this is caused by, that mutation. And so it's important to remember that, but also to be proactive about that as well. That's my 2 cents. I'll say that was 3 cents. 3.
Yeah, everybody should be on some kind of therapy if you have sickle cell disease. Yeah.
And I know a lot of people say, some therapies don't work for them, like, hydroxyurea, like they started off and it was great for them and then it just stopped working. And that's a real thing too, just so you know, like that's real. That's an experience for people. And so sometimes you try a therapy and it doesn't work out for you. Sickle cell is not one size fits all, and neither are therapies. And so, kind of just keep trying, see what's available to you, whether it's blood transfusion if you're getting apheresis, but just making sure if you're getting transfused that you are checking our iron levels so that it doesn't cause another problem down the line. So there's a lot of ways to think about this on, kind of how you want to manage your sickle cell disease. And everybody's sickle cell disease is different, so it'll look different for everybody. That was a great question. Thank you for submitting it. I want to go ahead and jump into one of the questions I saw here. Somebody talked about I've had a leg ulcer twice, same leg and location. How to avoid this? I heard hydrea can be a contributing factor, and that's something I've heard too. Taking hydroxyurea, leg ulcers seem to heal a lot slower. Is that correct, Dr. Q?
Well, I've read articles on both sides of it. Some people feel like hydroxyurea, I don't think hydroxyurea may not prevent leg ulcers like it prevents other kinds of things, but I don't think hydroxyurea, well, what I've read is that hydroxyurea does not contribute to leg ulcers. Leg ulcers are really common, particularly in the kind of the equatorial regions, because people don't wear shoes all the time. It's really hot, etc. And they are really, really hard to cure. And they tend to reoccur because after they heal up, if you have them, you'll notice that the skin looks a little different. It looks thinner. And so it's more prone to damage. So they are really difficult. A lot of it is trying to prevent more reoccurring damage in those areas, like wearing high shoes, etc., whatever. But they're really, all I can say is they're really hard to cure. They're really,
and they're painful.
They're extremely painful. You have pain
Yeah,
before
I feel
you
for
see the
you.
ulcer. Like you
Yeah.
may see, they start off as a little tiny black area of what we call necrosis or cell death, and then they just kind of explode. And when they're open, they are painful. So yeah, leg ulcers are a problem. I'm not. There have been reports that they're associated with hydroxyurea, but so many people take hydroxyurea, it's hard to say whether they contribute or not, So a couple of people have said they stopped hydroxyurea because of hair loss. Depending on what you call hair loss is pretty common. There are two things that are common that don't really contribute to your health very much, except they're cosmetically not so great. One is you can get black nails. You can get little black lines on your nails from hydroxyurea. That's fairly common. And a lot of people lose hair, but they don't, it's not a lot of hair. Like I'm old, right? So my hair is falling out. It's really thin. But that's just because of my age. But hydroxyurea can do that, but not to the extent where maybe other people would notice. If it is, then that's something you have to you just have to decide, do you want your hair or do you want to have less problems with sickle cell disease?
Yeah, and that was something that I thought about too before I started taking hydroxyurea. I do get the black things, guys. Don't judge. My nails aren't done, but I want to show you. Do you see that like black line there? That's from hydroxyurea. I have that on my thumbs. I think I have it on my toenails as well. And so I got that. I don't think I noticed hair loss for me personally, but that was a conversation I had like in my head with myself, like if I start losing my hair, am I still going to be taking hydroxyurea? And I said yes, because like Dr. Q said, you don't need your hair to live. Like I can cut my hair off tomorrow and be fine health-wise, right? But you need your heart, you need your liver, you need your kidneys to live. And hydroxyurea helps with those organs. And so it's kind of like hair or organs. And you know what? There's not even a right answer to that though, right? Like hair can be like very, very important to some people. But for me personally, I was like, okay, I'm gonna try and protect my organs, right? And if my hair falls out, and make sure I keep it in braids, or I'll they got some really cute wigs, I'll make it work. And so that was kind of how my thought process was with this. And then with the nails, that was even less of a problem to me. I was like, okay, bet I'm gonna be in the salon every other week and make sure I get my nails done. Here's my budget for that, and my nails will be looking cute. But y'all can see I haven't made it to the salon, but I'm still fine. So that's kind of the way I thought about hydroxyurea and like, the hair loss and the nail discoloration.
I mean, I think, every medication you take has side effects. There's nothing in medicine that is without some kind of side effects for some people. So not everybody has hair loss with hydroxyurea. Not everybody has it's called melanechia, or the darkness of your nails, but some people do. And then you have to decide, what is the side effect that I just think is intolerable? I'm not going to do this anymore. Is it cosmetic, or is it really something that affects me physically? And with hydroxyurea, there is a decrease in fertility, particularly among males. So doctors will tell you to stop hydroxyurea if you plan on having children, whether you're a male or female. And so by stopping hydroxyurea before you're planning on having children, probably makes it more likely for a male that you will have children. You never become sterile with hydroxyurea. You just have a lower sperm count, which people with hydroxyurea or people with sickle cell already have a somewhat lower sperm count, and this makes it a little lower, but you're not sterile. It doesn't cause sterility. It just decreases your sperm count, which recovers once you stop taking the hydroxyurea.
And you only need one sperm to impregnate. So just saying, like, what are all those extra sperm for anyway? No, I'm playing. Don't mind me, guys.
True. That
Don't mind
is
me.
true. There's a lot of people on this planet who were not planned.
Don't mind the nonsense coming out of my mouth. All right. I want to ask this one. Can you talk about type SC, sickle cell type SC? Doctors here see it as less severe, so don't give us the needed attention even when I have a crisis. And that is so real. So let's talk about it.
Okay, so people with hemoglobin SC disease, they have a higher hemoglobin. It's, like when you read a textbook, it says SS, their hemoglobin's 9, but that's like, to me, that's kind of a high hemoglobin for SS. It's usually about 8 or something like that. Anyway, but SC can have a hemoglobin that's almost normal. It could be 12, it could be 10.5, or maybe even higher, which is not that great because that means your blood has more viscosity. And so if you do have a sickle cell event, if you get, say, dehydrated or you're sick, your pain is going to be the same as somebody who has SS, who has more pain problems more often. So there's, and the other thing with SC is there are every type of sickle cell has complications that occur in one type of sickle cell disease, but not so much in another type. And in SC, retinopathy or problems with your vision, the retina, the back of your eye, that is really common in SC. It's less common in SS, and I think it's even less common in S beta serothal, but I may be wrong about that. But it's very common in SC. So that's something that if you have SC, you have to think about. The other thing with SC is if you do get sick, say you have acute chest syndrome or some other major organ problem, you can't generally get a regular transfusion because your hemoglobin's so high. It would make by getting a transfusion, it could increase your blood viscosity. So then you have to have an exchange transfusion if you get really sick. And just because you have SC doesn't mean that you're not going to have acute chest syndrome. You're not going to have other problems like people with SS. You can have splenic sequestration. That happens in people with SS when they're, toddlers or before 5 years old. But in SC, it can happen when you're like a teenager or a young adult. So the same things happen, they just happen at different times, and they can be serious. So the one issue with SC that is kind of a bummer, really, is that there's no specific treatment for SC. There's no medication like there is for SS, for SC. There's nothing that people have come up with, like maybe your hemoglobin should be a little bit lower with SC, or whatever. Maybe hydroxyurea would help people with SC. I had a couple of people with SC who had really a lot of complications on hydroxyurea. And I can't say that there's never been that I know of, there's never been a study to put a lot of people with SC on hydroxyurea and see whether it actually helped people with SC. It doesn't have the same effect because your hemoglobin's so high part of the reason why it works in SS is because your hemoglobin's low and your bone marrow is really active, and that will switch over so you make more fetal hemoglobin. But yeah, SC, the pain is the same or worse. You can have much worse complications with pain and with acute chest syndrome. You have to find, like Cassandra says, you have to find somebody who knows a lot about sickle cell disease and is willing to do a little research and do a little reading if they're not really up on it. And that there's so much literature, there's no reason that you shouldn't, as a doctor who takes care of people with sickle cell disease, you shouldn't not know about the common things that happen with the common types of sickle cell disease. It's everywhere. So it's easy to find out.
Hopefully that answers your question about SC. I always hesitate, like, if you tell somebody your henotype or like a provider your genotype and they already assume they know what type of sickle cell you're dealing with. Sickle cell should be dealt on an individual basis. Textbook wise, I have SS, right? Textbook wise, I have a very severe sickle cell, or the severest sickle cell, type SS, and I should be getting sick often. The last time I was hospitalized was 2017. Meanwhile, I know other people with SC who are hospitalized a lot more often, and that's supposed to be the mild version of sickle cell. So when you're talking to providers, really urge them to kind of look at your health history, right? And make sure that your care is more representative of your health history and what you're telling that provider than your genotype. Because everybody with sickle cell is different. Me and my sister have the exact same type of sickle cell. So I have sickle cell type SS, and then I have single gene deletion of alpha thalassemia. And basically what that means is it makes my cells a bit smaller. That single gene deletion of alpha thalassemia. And so my cells are a bit smaller. And so they get through blood vessels a little bit. It's technically supposed to make my sickle cell a bit more mild. And my sister has the exact same thing too. Like, sickle cell can get really, really complex when you add in, all these other genetic factors. But my sister has SS and single gene alpha thalassemia deletion as well. And the last time she's been in the hospital was like 2 months ago. And she's in the hospital a lot more frequently. So on paper, we look exactly the same genotype wise, but in real life, we present very, very differently. She has a lot of chest problems, a lot of back problems. Mine are my bones and my joints. Blech. Bones and joints. And so those are the problems that I deal with probably now on a daily basis. Hers is more so her pain is in her back and her chest, and she gets like acute chest or pneumonia more often than I do. So you see one person with sickle cell, you see one person with sickle cell, and that's what it is at the end of the day.
And that goes for SC and all types of sickle cell. You can't generalize about anything. The other thing is, you sort of, as a physician, you have to expect the unexpected. You can't just, if someone has pain and they say it's different than any pain, you can't just say, oh, well, that's okay. People with sickle cell have pain. Here's some pain medication. You really have to be on top of it with people who have sickle cell disease. It's really important to not blow things off or think you know when you really don't know for sure.
Okay, I really want to ask this question because I've never seen it before.
Uh-oh.
It's about hydroxyurea still. And okay, first of all, I want to, my hats off to this person. Thanks for sharing. But it also is like very personal. Whenever I start taking hydroxyurea, my skin smells different. in my discharge too. It like metallic smell. Does anybody else experience this too? And the reason I want to ask this or call out this question is because this person knows their body. And I love that for them. Like, you notice like any tiny thing that's off, like you know your body really, really well. And like I always encourage people with sickle cell to know their body like so well that like the tiniest, like you can tell when your one hair on your eyebrow is laying different that day. No, I'm playing, but it's so good to hear and see people know their body so well, like in that way, because that's you have to with sickle cell. And so I wanted to put that out there. Please comment if that's something you've ever experienced. Dr. Q, have you ever heard of something like that?
I haven't, but you know,
Okay.
a lot of people, like you say, they don't pay that much attention, maybe, you know, I don't know. But I've never
And this
heard
is the level of detail you need to have with sickle cell. Like, trust me,
you
this is
know,
the level of
medications
detail. Mhm.
medications do different things to different people. And if you're a doctor, the only things you hear about are things that are relatively common. Even if they say, oh, this is uncommon, it's still pretty common, or it wouldn't be on the list of problems. Things like you smell a little bit different, stuff like that. People, number one, they never tell anybody. And number two, it's probably relatively rare, but nobody knows for sure because you know, people just don't talk about it.
Do you guys want to hear something? Because this person shared this, I'll share some weird stuff about me. Well, I don't know. Well, let's just see. Let's just put it out there. I notice that my hormones, and maybe this isn't that weird, I don't know, but it's weird to me. I noticed that my hormones cause a lot of pain in my bones. So when I have bone pain, it's either caused by my hormones or it's caused by the weather. And those two things, and then sometimes if I'm like hormonal and the weather, it's like double whammy. And I swear, like, I feel like I'm the only person on this earth that deals with something like that, where it's like the hormones are like, or my pain is based off of hormones and weather. And I can always tell when my hormones are like kicking in, or I don't know what the right word is for that, because I have like pica cravings. And like I like watching vacuum videos, and like my urge to watch vacuum videos is a lot stronger when I'm hormonal. Anyways, that was weird, huh? But that's what happens to me, like, and that's what I notice about my body. And do you know what? I'm not even embarrassed to tell like my doctor that. Like, and I do, because like I want them to write that down and put it in a medical book somewhere so that maybe it helps somebody else. Like, have you ever heard of a patient who likes to watch vacuum videos because they're hormonal? Like, no, but at least this is documented, right? So, that's my weird whatever. Those are like, but it's important. My point is it's important to like really be in tune with your body in that way. To know like the subtle changes in, you know, medications or just hormones or anything that's happening to you. So yeah, I'll stop. Was that cringe?
You know what I was thinking about while you were talking. What you need, what you need to, if you're looking for a doctor, what you need to have is a physician who can sit and talk to you just the way we're talking on this program, because you should be able to say anything you want to say to your doctor, and they should sit there and take it in, kind of put it through their little medical brain, and either just say, oh, well, that's kind of interesting. Or, hey,
And they
that's a problem.
shouldn't raise their eyebrows either. They
No,
shouldn't be
no.
like, you know, or like make any type of face either. Like they shouldn't.
I mean, if you're telling a doctor something, no matter what it is, you must it's a problem for you or an issue for you, you wouldn't
It's
be telling
noteworthy.
this
Yeah.
dude or this woman who doesn't know anything really, so much about your personal life. But I'm a kind of a talker. I spent a lot of time with patients just chatting, and I learned a lot about how they cope with sickle cell disease and how the trajectory of their life was just by talking to them. And it's really important. Some guy who's sitting or girl who's sitting there on their computer and they're in front of their screen and they don't even look at you, that's not the best type of doctor for people with sickle cell. It might be okay if there's nothing wrong with you, but if you have sickle cell, they got to pay attention.
Okay. I think I'm behind on questions, so I'm gonna go ahead and see if there are any new questions. Oh my gosh, someone said my mom would tell me my breath would change when I was getting sick. Sometimes an hour later, I'd feel the crisis. She knew me so well. To be known that well is to be loved. I'll just say that. If someone knows you that well, oh, that type of love. Anyways, that's amazing. That's amazing. Here we go. I could eat an elephant, but my weight barely changes. My BMI is underweight. Any work around people? So gaining weight, how do we do it with sickle cell?
Okay, so if you have sickle cell disease, your metabolic rate is really high because you're making red blood cells all the time. And so you need a lot of energy to do that. You need a lot of calories in order just to keep your body sort of homeostatic. You're making enough blood cells and to keep everything working. So even though you eat a lot, you don't put on a lot of weight. That's not true for everybody with sickle cell disease, but a lot of people with sickle cell disease are on the thin side. And what I think you have to do is, even though you think you're eating a lot, you may have a diet that's not like really high in calories. Like you might talk to a nutritionist at wherever, if you go to a hospital for your sickle cell disease or your PMD is at a hospital, because even though you think you're eating a lot, you may not be getting that many calories. And for sickle cell disease, you need calories. The amount of food is not as important as the calories, although food is really important for people just generally, but for people with sickle cell disease, you want to have a anti-inflammatory diet, which means lots of fruit and vegetables, not that much meat, not that much processed food, sort of like a natural diet. That will make you feel better. The trouble with that diet is you got to eat a lot because it's not really high in calories. Like processed food, the reason why everybody likes to go to McDonald's and go to places is because it's very dense in calories and not very nutritious. The nutritious food may not have a lot of calories, so you might have to, that's why you might want to see a nutritionist. What can I eat that will increase my calories that isn't bad for me, that isn't pro-inflammatory?
What's something with a lot of calories, or what kind of foods have a lot of calories?
Oh, anything with sugar. Sugar has a lot of calories. Fruit has a lot of calories, which is a good anti-inflammatory. So you want to eat a lot of fruit. If you think about it, apples, oranges, grapes, all that kind of stuff. It's got fructose. That's why they call it fructose, because it's the sugar that's in fruit. So if you feel like, I want to be on an anti-inflammatory diet, but I want to also keep my weight up, you think about, starch, potatoes, that kind of things, but not French fries, but potatoes and starch food, bread, that will also is relatively high in calories. But fruit is a good source of calories and it's good for you. These things, we live in California, so it's easy for us to go to the store and we can get all kinds of fruit. But if you live in some areas of the country, during the wintertime, you don't get that much fruit. But fruit is good for you, vegetables. Meat's not bad. You do need protein, but you don't want to eat a lot of meat. It's very pro-inflammatory.
Meat is pro-inflammatory?
Yeah, yeah.
Interesting.
It also takes a
Okay.
lot of energy to process meat in your body as well. You got to break it
Okay.
down and turn it
So that
into.
little energy that we have, the little tiny amount of energy, if you're eating meat, it takes on more energy than
Yeah,
what?
yeah,
Than like what? Like vegetables and fruits and
yeah. But
okay.
you do need protein, and sometimes it's hard to eat if you don't eat legumes like beans and rice and other things. And corn has a lot of lysine in it. Then the reason why people like meat is it's like you're eating yourself, right? You're made out of meat, you eat meat, so it's got everything you need, sort of. But to do
Interesting.
that with vegetables, if you're a vegetarian, you really have to be conscious about what you're eating. You can't just, and eating fish is good for you, so you could supplement your diet with fish. A little bit of meat is fine, but if you have a McDonald's burger, a Big Mac 3 times a week or 4 times a week, that's probably not so good for you, along with the French fries that you always get when you get that Big Mac.
Hey, not too hard on my French fries though. Dr. Q, you're a vegetarian, right?
Yes, I am.
Okay, so you guys are talking to two vegetarians. I'm vegetarian, Dr. Q, so
Yeah, so
anyways,
we have a bias against
we
eating
have a bias. Just
eating animals. That's not our big thing.
and that's why I said not too hard on my French fries, because that's one of the things I can't
Yeah.
eat.
Well, that is, and it's got a lot of calories, really,
Okay,
Oil,
so French fries
a
have a
lot
lot
of
of
calories.
calories.
Oil, like if you fried foods and stuff or whatever, that has a lot of calories in it.
Okay.
The
I just
hippie
wanted
mom also thinks the vegetarian diet is good for people with sickle
who?
cell. I really think it is. I think
A vegetarian diet is good for
yeah,
people with sickle cell?
vegetarian diet is really good. You just have to
Mm,
make sure you're getting the protein, especially in kids. Kids are growing and they need protein and stuff to grow. It's hard to be a vegetarian if you're a little kid because you need the protein, which is kind of hard to get if you're a vegetarian. Oh, somebody says, beef is tearing me up. It starts a crisis before I even get to digest. Okay.
wow. I became vegetarian, never really liked meat growing up, and I'm Nigerian, and like a lot of the dishes have meat in it, and like I would say no, and my grandma would be like, "What's wrong with her? Like this meat that everybody's fighting for, you don't want." Okay. Anyway, so I didn't like meat, and then I saw this documentary on Netflix, and it said something about like meat making your blood cloudy or like it makes your blood murky. And I'm like, well, if I have a blood disorder and meat is contributing to murkiness to my blood, and I already don't really like meat like that, like at most I'd probably eat like a chicken breast and it would be like dry, not even like the nice, you guys talk about the dark meat and the juicy meat and all. Nah, that wasn't me. I like the dry white chicken breast meat, and like even that I was just like, it's all right. So I just stopped eating meat and haven't looked back since. I am not vegan though. I would like to become vegan maybe, but the thing about cheese and eggs, that's really hard for me, guys. That's like that one's really hard. So maybe I'd just be vegetarian. Are you vegan, Dr. Q, or are you vegetarian?
No.
So
No,
you
you
eat,
need, when you eat meat, the reason why your blood gets cloudy is because of the fat.
okay, okay.
So you get a lot of lipids and stuff in that. But I'm a vegetarian, but I'm not a vegan. And
Okay.
if you have children, they should not be vegans. That's really not good for you, for our kid. They need to have protein that, maybe once a week, or they should be eating some kind of fish or something like that. They need eggs, has a lot of good protein in it, cheese. So you can't be a vegan if you're a kid.
Yeah. I wanted to circle back around on this comment. It says, my hematologist is always in a hurry for his next patient, spends like 2 minutes with me, then the next appointment is in 6 months. And this is real. And let me just speak quickly to this. There are so little amount of hematologists that the ones that do exist have an insane amount of sickle cell patients, which is why they probably only spend 2 minutes and then they're on to the next, because nobody wants to be, especially an adult hematologist, nobody wants to be an adult hematologist. So there's very, very little amount of hematologists. So my question to you, Dr. Q, is what can you do to build that relationship? And you talked about having a meaningful relationship with your provider. Does it have to be with a hematologist, or can it be with somebody who has who is a primary care physician, or what's the workaround for that?
Well, I'm a pediatrician, so I'm not a hematologist.
Yeah, he doesn't like us adults. He doesn't like us. No, I'm playing.
I had my oldest patient was 38. So some people can't get people just can't get it. They can't divorce their pediatrician. And
guys, that was me. That was me. No, I wasn't 38, but Dr. Q finally pushed me over to adult care because I was having a baby. And he's like, okay, now you're having a baby, so I think it's time for you to go to adult care. And I was like, no. But no. So yeah, he's a pediatrician, but
any doctor who has an interest in people, you have to, and they can be a sickle cell doctor. I can tell you. So I was in private practice, but I always sort of wanted to do sickle cell, be a sickle cell doctor. And the way things were working, I just decided that's what I was going to do. And I was fortunate because I was at Children's Hospital in Oakland. There were 2 clinics a week. And so I could spend a lot of time with patients, like half hour would be kind of normal. And you really kind of need that. They would be in the clinic for that long because I would see them, they'd get their blood work, they'd come back, we'd talk about their blood work, whatever. And so we spent a lot of time. And then if you were a brand new patient with a new baby, and this was your first experience with sickle cell, I would set aside an hour for that first visit. And then you would come really frequently, maybe as frequently as you could do it, and we just go over sickle cell disease. And that's really important for the parent to know something about sickle cell disease. And as kids grew up, they would hear the conversations and they would learn about sickle cell disease just listening to me talking to their parent. And once the kids were like, I don't know, 8, 7, something like that, then I would talk to the kids too, because they needed to know about Dr. Q's from California. So that's how my practice was. If you have, and my doctor doesn't, if I had sickle cell, I wouldn't have my doctor because they don't spend any time with me either. and part of it is because I come and I'm not sick. So they don't, it's like, oh, you're fine, you know, here, oh, your heart's beating, you're breathing, I can hear you breathing. Oh, you know, you've got 2 arms, 2 legs, and your eyeballs look okay. So I'll see you in 6 months or something like that. So that's the common thing. And like Cassandra says, they have a tight schedule, but it should never be so tight that they can't spend 15 or 20 minutes with you. To me, it'd be like the minimum, or longer, or have more frequent visits. If you have problems, maybe you shouldn't wait 6 months. Maybe you should be seen, you know, in 3 months or something, whatever. But it's hard to find adult sickle cell doctors, and they're at a high premium. So, and most people don't just, I only did sickle cell, I didn't do anything else. And most doctors don't have the luxury of only having sickle cell patients. They have like a whole bunch. But anyway, medicine in this country, we spend the most money on medicine of most developed countries, and we have the worst healthcare. So I don't know the details behind that. That's just I read in the paper, but I can definitely believe it. If we had national health care like they do in Canada, the UK, probably most of Europe, we would be much, much better off, because then everybody would get good care, not just sickle cell, but everybody. Yeah.
I'd be hearing from them British people too about their hospitals. They all have care, right? But sometimes it's education around care. I saw a video.
Oh yeah.
Like people aren't educated, so they get, so it's always something with care and sickle cell. There's nothing perfect out there.
Well, your doctor has
But
to be interested in sickle cell, because if you're not, you don't get taught sickle cell disease when you're in medical school. So you have to, it took me about 2 years before I felt like I knew something about sickle cell, that I could kind of like, I felt more comfortable. It was a lot, and that was in the day when they had 10 sickle cell centers in the country. And once a year, you'd go to a big meeting it lasted almost a week, I think. And that's where I learned about sickle cell disease, talking to patients, talking to other doctors, talking to nurses, social workers. That's where you learn about sickle cell disease. It's complicated, and it takes years. And most doctors don't have the opportunity to only take care of people with sickle cell disease. So that's a problem.
What I will say, what I'll add to this is, I always go in with questions that I need to have answered before the visit is up. And so go in, no pleasantries, like, oh, hey, hi, here's my first question. And the way we start this live, dive into the first question. Just dive right in and get your money's worth.
It's really good to have a list of questions, because you're going to get sidetracked by the doctor, by things going on. And if you don't have those questions, you're going to walk out of the room and say, oh, darn, that was the question I really wanted to ask. But if you have them written down, make a copy, hand it one to the doctor and say, these are my questions. And then you have it and you go through it. And if you're really compulsive, you could even take a pencil and take notes. But usually you don't have to do that, because you probably know more about sickle cell than the person you're talking to.
Yeah, so write down your concerns and questions beforehand, and they're not gonna be like, oh, I can't answer all these. Trust me,
right.
they will not say that. They'll make sure to answer every single one of those questions. So just when you have an appointment come up, just prepare for it. Make sure you're prepared for it. And then if you feel you're not getting enough time, increase the frequencies of your appointments as well. So instead of every 6 months, I think My hematologist told me that I needed to see them every quarter, so every 3 months.
Yeah.
And before that, I was seeing them like once a year or maybe not even that. So, just to kind of give you guys an idea of how often you're supposed to see your hematologist, they say probably once every 3 months, and that's if everything is good.
Yeah.
So,
The other
it could
thing you
it could
need
be
to
more.
ask, the other thing you need to ask your doctor about is your lab tests. You really need to have, you need to know what your lab tests are, and you need to know what they mean. And a lot of doctors will do lab tests. They look at them, but they never tell you
Yeah,
anything.
yeah,
And so, for instance, I think personally, if you're an adult with sickle cell, you need to have a ferritin, I don't know, once a year, depending on how many transfusions you get a year, to know whether or not you're getting more iron overloaded. You need, if you're on hydroxyurea, you need to know what your fetal hemoglobin is. If it's 10%, there's that your dose needs to be tweaked a little bit. You need to know what your white count is if you're on, I mean, it's a whole big thing, and doctors should know this stuff, and they should explain it to you, because it's important for knowledge. I always say knowledge is power. The more you know about your sickle cell disease, the better care you're going to get, because then you know what to ask people. And if they don't answer your question, you can kind of needle them a little bit about, hey, wait a minute, what about this? What about that?
yeah. I saw somebody who was trying to ask a question. Their username starts with a T. Please ask it again. I promise we're not trying to ignore you. It's just there's a lot of comments I'm trying to go through here. So please ask it again. I think this person, I'm still trying to find their name. I don't think I'll find it. But if your username starts with a T and you were asking questions and you felt ignored, please ask your question again. I'll try and search for it here. In the meanwhile, I want to ask, why can't we hit the swimming pools? Any explanations on that? And then what I'll couple this with is what are common triggers for sickle cell disease? And I would say swimming pool or going swimming in cold water is one of them. But what are other common triggers for sickle cell disease?
So anything that vasoconstricts, which means like cold, like if you notice when you go into a pool, if you have any blood vessels you can see somewhere, they just go away. So anything that vasoconstricts, and that means the vessels are getting smaller, so you're more likely to have sickling in those small vessels that block off and cause pain. So anything that does that is going to cause pain. So if you live in a cold climate, like someone asked about, what about living in somewhere where it snows? You can't go out in a t-shirt. You have to wear, you have to bundle up probably more than other people because it's really cold, and cold definitely causes pain. A lot of women during their cycle, they get pain, and that's been shown to be true. Doctors will say, oh, no, that can't be true. Well, it is true, because one of the great doctors in sickle cell, Dr. DeBond, did a study to show that's what happened. Stress, if you're really stressed out psychologically, that can cause you to feel pain or be more aware of pain. What else can cause pain? So it's like cold. Dehydration. If you don't drink enough, you will have more pain. especially if you're sweating or it's really hot out, and you can have what's called insensible water loss. You're not sweating, but your sweat is evaporating off of your body before you even know it's there. And so when it's really hot, you have to drink a lot of fluids, or you will end up getting achy and you can have even worse pain. Same thing with, this is one of the things with sickle cell trait. It's one of the things you have to do if you have sickle cell trait. You have to stay hydrated when you're exercising. So.
All right, I pinned this question so that I wouldn't forget to ask it. Somebody's been asking about constant bone pain without stopping for the past 3 years. Please, what can I do about this? And whoever you are, I feel you. Me too.
Yeah,
Go for it, Dr. Koo.
bone pain. There's, your bone marrow is where all your blood is made, and your bone needs to have these teeny little vessels that go in because your bone needs blood too. And even though your bone marrow is where your blood is made, it's not, it's in the marrow, and you need to have blood circulating through there to nourish the marrow, be able to make your red blood cells, etc. And those can be occluded by sickle cells polymerization, just like anywhere else in your body. And that's why you get avascular necrosis, is because the vessels going into your femur, the head of your femur, there's only one big vessel that goes in there, which contributes to it. But those vessels get occluded, and it kills the bone. So, and that's really painful. So you're probably having really small infarcts in your bone all the time, just like Cassandra says. Even when you're not having sickling, or not having pain, you're having sickling. And the bone pain can go from probably, Cassandra knows this better than me, but from being annoying to really being severe.
Like you wanting to punch the wall.
Yeah.
That's how I feel. Yeah.
Yeah. So Cassandra can speak to that because she does have bone pain, but it's because the bones need blood just like the rest of your body. And if you have sickling, hydration and stuff, probably everything that you do to prevent pain will help your bone pain. And if you're not on hydroxyurea, that might help a little bit. Bone pain is different than other kinds of pain. It's really. And the other thing is you got to use your bones. Like someone said, you got to walk, you got to use, it's not something like you can, they're weight bearing, you're always weight bearing. And so bone pain can be very, very severe and limiting. You can't do things that you would like to do because of your legs or arms or whatever hurts so much.
Y'all, these are some really good questions.
If you do have a lot of bone pain in one like in one hip or one joint or something like that, then you need to go to your doctor and have an MRI to make sure you don't have AVN. Because if it's a joint pain, is different from bone pain, and joint pain can be AVN. Bone pain that doesn't go away in the same place can even be osteomyelitis. It can be an infection. So I've seen, over the decades I took care of people with sickle cell disease, I've seen the craziest stuff. And we had a young lady who actually was complaining about knee pain all the time. We sent her to an orthopedist who discovered that that she had an infection in the bone that didn't show up very well on X-rays or MRI, and he was able to give her antibiotics. We sent her back to us, and we gave her antibiotics, and I think he did some surgery to clean out the bone, and she did okay. But bone pain can be a sign of infection as well.
Okay. Tons and tons of good questions coming in. So the next question I have for you, Dr. Q, is what does drinking do to a sickle cell patient?
Like drinking alcohol? Is that the
I'm
kind of-
assuming. It does nothing. No, I'm playing.
Drinking water is good. Drinking alcohol is not so good. Alcohol it's kind of like a diuretic. You pee a lot, and so you're not replacing, especially if you're drinking like hard liquor and not a beer. You're not replacing that fluid, and so you become dehydrated while you're drinking. And while you're drinking, your brain kind of gets a little muddled, and maybe it's hot out, you're by the pool side and you're drinking and not realizing, hey, I should really be drinking more water than I'm drinking whatever wine or something. And so that will cause dehydration and pain. If you have problems with your liver, like if you're iron overloaded and you're drinking isn't good for your liver either. I think it's okay probably to have, a wine once in a while or a beer, but to be someone who drinks, a lot, that's not going to do your body any good. No organ, and there's nothing in your body that likes alcohol. Everything that alcohol does is negative, including muddling your brain so you do something really dumb that you shouldn't be doing when you have sickle cell disease.
That's just what I wanted to say. Alcohol is considered a carcinogen. But don't quote me. Go and look that up for yourself, because that's what I read somewhere, and I'd be reading a lot of things. But alcohol is already bad for somebody who doesn't have a health condition, then it's going to be bad for sickle cell. You just know it. And this is not to say I don't drink, but I feel like I've kind of lost interest though. Maybe I've gotten to a point where like I've drank all the alcohol I've needed to drink and I'm good now. Like, and you guys should see my cabinet. I have a lot of alcohol. Like if you came over, my husband could make you a good mean drink. But it's just I don't know. I don't see I don't know what the appeal is anymore. And then I also read that like apparently Gen Zs drink less alcohol too. So I just think that people may not I don't know. I don't know. But if you do decide to drink alcohol, if you were like me in college, in a sorority, had thirsty Thursdays, just wanted to be part of like the vibe and everything, make sure you're drinking lots and lots of water. Like for I like taking shots. For every shot I took, I drank like a couple glasses of water, to make sure it's like kind of like even flow, like even buzz, and it's not just gonna hit you like a train. So just try and be as responsible as possible. Am I saying I was responsible? No. But do as I say, not as I do. And just really, really look out for your health with that and with alcohol and sickle cell, because you can get dehydrated and then end up in a crisis, and then I don't know, would that night be worth the crisis for you? I guess that's how you have to think about it. It's like, is this worth a crisis right now? And sometimes the answer is yes. I'm playing. I'm on one today.
Don't give bad advice.
No. It's never yes. It's never great to have a crisis. It's never great to be in pain. But just drink responsibly. Just make sure you're following up with lots and lots of water, because you don't want to wake up in the hospital. So really want to ask this question, and I see some other questions coming in. But I feel like maybe there's an interesting take on this one. It says, am I the only sickle cell patient that has gotten discharged from multiple hematologists? And I wanted to bring up this question because to me, this read as you haven't found your right doctor. You haven't found your fit. And finding a fit is important for healthcare, or, you know, is important for your care. Now, I don't know the details of why these hematologists are discharging you. No, I'm playing. But, you know, you do need to find someone that's willing to work with you, with your health, and, you know, help you through any issues and, you know, health problems you have. And somebody said earlier on the live, you know, their doctor only sees them for 2 minutes. Maybe that's not the right doctor. If you are someone who needs that additional time, then maybe that's not the doctor for you. It's almost like finding like a significant other. Finding a doctor, you have to find the right one. And just luckily I found Dr. Q. But like, and I think Dr. Q is everybody's like ideal, like significant other in a way, because he just goes so well with everybody. But it is like I just wanted to say it does take time to find that match, or to find that person that fulfills your need as a provider. So to me, that question read as you haven't found your right provider yet. You haven't found the person that you feel comfortable with telling that you watch vacuum videos to, and, you know, feel comfortable with, you know, sharing your deep dark secrets. You haven't found that person. So that's what that means to me. Do you have any thoughts on this, Dr. Q?
Yeah, well, I think you have to, when you have a doctor, you have to look at it in a sort of a way like, do I trust when you have sickle cell, do I trust my life with this person?
Exactly.
Can I trust this person to take care of me? And if he doesn't, or she doesn't know the answer, that they're going to go find the answer from somebody, they're going to ask another doctor, they're going to call somebody on the phone, whatever it takes. And then also the person has to be kind of like, I don't know, they have to want to sit and spend time with you. If you come in and you've got something really going on and they allotted 15 minutes for you, you have to say, well, I'll give you, you know, in your brain, you don't say this, but in your brain, you think, okay, I'm going to listen to this person and figure this out. And then maybe you tell the nurse, hey, you know, I'm going to be a little bit late for the next patient because I'm busy with this person. And also, you know, you really have to really give people a lot of slack when you're taking care of people who have really serious medical problems. You can't like blow people off like, well, I don't think your pain is that bad, you know, what stuff. You just have to be more in tune with the person, and spend time with them. If you don't spend time with people, you don't develop a relationship so you care about them, then it's hard to take care of them. And I was fortunate, I guess, my personality, because I really cared about all the people I took care of. And so that helped me take care of them because I cared about them enough to do a good job. And a lot of people, all different kinds of people become doctors, and some people just don't have a real chummy personality. And they just don't have that empathy and compassion thing going on. And the other thing is, you know, I hate to bring this up, but there's also bias. I mean, some people may just not be able to, if you're white, maybe you just can't put yourself in the shoes of someone who's black, you know, you can't really just do that. And if you can't do that, then you shouldn't be taking care of people with sickle cell, because that's part of the deal. You really have to see their plight in life beyond just, oh, they've got sickle cell. Hey, they're Black. They probably had a really crummy, they've probably gotten a lot of static from a lot of people and a lot of bias, and their life hasn't been as great as yours has been because you're white. Nobody hassles you about it. So there's a lot of kind of nuances that go into being a sickle cell doctor. And that's definitely one of them if you're white, because you don't know that much about sickle cell, and you certainly don't know that much about being Black either. Even though you think you might know a lot about both of them, you probably don't.
I just wanted to read this comment that's I felt like deeply. Somebody said, this is to the alcohol stuff. I was a student who didn't want to explain to my parents why I ended up in the hospital because of alcohol. So I was super mindful. And that was me too, up until a certain point. Like, that was me. I just want to know how many of you has sickle cell kept you from doing anything that you shouldn't be doing because you didn't want to tell the story of why you were in that situation and why you were in the hospital? Because that was me. Like, I didn't want to be like it stopped me from doing a lot of stuff. Let me just say that. Like, sickle cell stopped me from, but because I didn't want to have to explain myself to anybody about that. So that was very real. I appreciated the comment. And yeah, that's kind of how I lived my life for a good amount of my life. I didn't want to call Dr. Q and say, hey, well, so I'm
Although Dr. Q would have been fine with that,
he would have been. Yeah. Is sickle cell considered a disability?
Yes, absolutely. So the American People with Disabilities Act applies to people who have sickle cell disease. Everything that you should have, for instance, you should have accommodations if you're in a job. You shouldn't have to stand up all the time. You should have rest periods. If you're a student, you should have an IEP to help you, because you maybe you missed, you didn't read that chapter because you were in the hospital or something like that. And then you get behind, and so you need an individual educational program. If you're a kid, you might even need to have neuropsychological testing to see whether or not there's some reason why, besides sickle cell, why you're not doing so well at school. You need to have, for instance, water at your desk all the time. If you're in school, I told the kids would be able to have a water bottle. They'd be able to go to the bathroom whenever they wanted to. So yeah, it's a disability, and it causes disability. So if you have sickle cell disease, you have hip disease, hey, you have another disability beside your sickle cell. So if people do not treat you as though you have a disability, then you should talk to a social worker and figure out, how do I deal with this employer who's not allowing me to do things like drink water, go to the bathroom, whatever. So that's definitely, you're covered by if you're in the United States, you're covered by the American Disability Act.
And I'll just say, a lot of people don't like saying that sickle cell is a disability, but that's for another reason. Just because, they don't want to let sickle cell run their life in a way. But like, just logistically speaking, I would say sickle cell is a disability, and disability doesn't necessarily have to have a negative connotation. It just means you need to have I love this quote from Dr. Q. It's about equity instead of equality. So it's like, what is needed for somebody living with sickle cell in order for them to, in order to level the playing field for everybody, right? And so stating that you are disabled or have a disability helps better level that playing field so that, you know, if you have, associated with sickle cell is a decline in executive function. So if you cannot focus on a test because you have sickle cell, getting extra time on the test would make that situation equal or closer to being equal than someone who doesn't have sickle cell and can focus on a test. And so that's why people would say, I have a disability, in order to have access to those resources that, that are permitted to you. And Dr. Q, you put out like a list of things that you should be able to access as somebody with a disability. I think that's a great list, and maybe there's something we can put together for that. Like, as a student, you should have a 504. I had a 504 plan. I got extra time on tests. I got to have a water bottle and a blanket if I needed one. I think that was it because I didn't want to draw attention to myself. And so like my mom would make sure I had these things. And I was like, Mom, no. But now I take advantage of every little thing. Like I have a handicap placard now, so those days where, I'm having crisis in my legs or whatever, I just put the handicap placard on and do whatever I need to do. And so make sure you do take advantage of those resources that are available to you under the label disability.
And the other thing is, if you're a parent of a child who has sickle cell disease, and you think that you're not an educator, you're not a doctor, you're a parent. So if you think that your child is having any trouble in school, make sure you get an individual IEP, an individual educational plan for your child. A 501 in California just means you get things like what Cassandra was talking about, can have water, this or that. But an IEP means that you have an individual educational program and somebody has to write down what you need for that program. And the reason why that's really important as a child is because when you're 18 or whatever, and you want to go to college, or you want to go to a different school, and you can't all of a sudden say, oh, I've had sickle cell, and so I need these kinds of things. If you didn't have an IEP when you were a kid, it's very unlikely that you're going to get them when you're a teenager or an adult. So you need to follow that along. You can't all of a sudden decide you need an IEP when you're a senior in high school or a junior in high school. As a parent, you need to make sure your kid gets an IEP all the way through so that it follows them into college and they get extra time to do things or whatever. It's really hard if you're a senior in high school and all of a sudden you say, I need an IEP. That it's more difficult. So parents, get your kid an IEP, and if they have real problems, then they need neuropsychological testing to make sure that everything's okay. If you don't do it when they're young, it's really hard. You can do it, but it just adds a layer of difficulty on top of it if you decide to do it when they're 15 or something like that.
You guys are my people. I'm reading the comments here about like being embarrassed about riding around on electric buggies and you guys are my people. I for flying, you can tell them that they have a disability. I did this once and they put me in a wheelchair and drove me around and I got to cut all the lines at the airport. I'm not gonna lie, I was like a little bit embarrassed, but I was like, next time I need this, I'm gonna have like a big set of sunglasses and just try and look like a diva while I'm doing this at least so that, you know.
But that is
Um,
true. If you're boarding an airplane, there are people, you have a disability and you can board before other people because you may want to be in an aisle seat because you're going to have to get up if it's a long flight to go to the bathroom. So you don't want to be in that window seat and have to move people out of your way every time you have to go to the bathroom. So, if you need to let the airline know I have a disability, da 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 da. It'll make your
that's
life a lot
exactly right.
easier, even though it's for some people it's more embarrassing, but I wouldn't worry about that.
Yeah, I had to have a walker because I had AVN, and my
Uh,
sister's like, "Oh, put like bedazzle it and put all these like little jewels on it." I'm like, "So I can bring more attention to myself?" Like, no, thank you. I'm good. And I traded in that walker for like crutches instead because crutches seemed cooler to me. So that's how I got around that one. But yes, I do get seat upgrades if I tell them I have a disability. Listen here, I'll let you guys in on a travel secret. Don't tell anybody. I will book the cheapest ticket. And not okay, this is not all airlines, but I will book the cheapest ticket. And then as soon as I get the ticket, call them up or use their chat feature and say, "Hey, I'm flying with a disability and I need a seat with extra leg room." And they always put me in like, what is it, Comfort Plus or like, the premium economy seats. And that's how I fly because I call them and I say, "Hey, I have a disability. Please bump me up." And they do. I think the airlines that do this is Delta and United. I'm trying to think of any other airlines. And some of them I fly mostly with those because that's where I have my points. But some other ones may do it as well. But yes, and I do that for my daughter too. My daughter has autism, and I'm like, nope, she needs extra space. Sorry, she and we both need extra space. And then my husband, who's he's our caregiver. So, and he has to sit next to us. So that's pretty much, you guys, I swear you can't tell. That's pretty much a whole row in Comfort Plus because of disability. And this is what makes things a little bit fair in life for people with disabilities. Okay. So I'm not even, and it helps, like I don't get crisis. I travel with my compression socks. I'm able to like move my feet around and like my feet don't get stiff and I get in a crisis. My daughter, who has like spatial stuff, like she's able to move around and not feel so constricted. And then my husband, as long as we're doing good, he's doing good. So that's how that works.
the other thing is, if you are on a plane and you don't get up and walk, it's a long flight. You don't get up and walk along. You can get blood clots in your legs, deep venous DVTs. I could get them. Anyone could get them. But if you have sickle cell, you're much more likely to get them. So even if you are lounging about in a special seat that Cassandra just told you how to get, you still need to get
Watch
up.
me not be able to do that anymore because everyone's gonna do it.
You still have to get up and walk around a little bit.
Yeah.
Or like, I think Cassandra uses compression socks, right?
I do. I do use compression socks. And then I get up. And if I'm flying with my daughter and my husband, like, it allows me to get up within the row. And so I don't necessarily have to walk up and down, but I try and walk up and down too. And then plus my daughter, she always has to go to the bathroom, so she forces me to get up. So
And oxygen really helps too. I don't know if you need you probably need a prescription for the oxygen. And somebody may want to, there are ways to test to see if your oxygen level goes down when you're in an airplane, because the oxygen, when you're in an airplane, it's equivalent to being like at 8,000 to 10,000 feet on a mountain. So there is less oxygen in an airplane than there is when you're sitting around at home, if you're at sea level anyway.
And you guys, somebody brought up a really good point. It's embarrassing because people see and judge you as your youthful appearance. This is something that I think about at times, right? Like you see me and then I put up a handicap placard or I'm in a wheelchair. They're like, what the hell is, like, and I always tell people on this live, I'm so ready. Like if you come to me and look at, and I put up my handicap placard and you're side-eyeing me, trust me, I am ready. I have this whole conversation in my head. It's saved. It's in a special part of my brain that I am ready. You will get educated about sickle cell. You will know more than you wanted to know about sickle cell. Like I'm ready. So.
And that's why when you go into an emergency room, you don't get treated because pain is invisible. You're youthful, you look beautiful, and they're like, what are you doing here? You don't have pain. You can't have that much pain. Seriously, that it's across the board. It's very difficult socially and in the medical system because people, you look great. So why are you coming into the ED or whatever? I don't know. And you can't see pain. So, but as a doctor, someone says, oh my God, talk about it. If you're a doctor, then you just believe it. I mean, the person has sickle cell. Anyway.
I'm laughing at you guys laughing at my sister's bedazzled suggestion. I actually need a hearing aid too. And she's like, just bedazzle it. Like it's like it solves all of life's problem to bedazzle.
Yeah,
medical equipment.
Now you can get your AirPods from Apple, and they are FDA approved hearing aids.
You saw that, Dr. Q? You saw that? I was so excited. Because, that was always my thing. I didn't ever want to get hearing aids because they look like hearing aids, right? And it just doesn't go with my aesthetic. And, but do you know what does go with my aesthetic? AirPods. You guys, I'm vain. But yeah, AirPods go with my aesthetic, and I can always look like I'm on a conference call or something, but really be hearing. I tried out the hearing features on the AirPod, and the problem or the issue I had was you could hear everything. I just wanted to hear people talking to me or hear better people talking to me. But you could hear somebody crumpling paper 10 miles away, and that wasn't it for me. It became overwhelming. So I was just like, I just ask what, and whoever gets tired first, and then I do the smile and the nod, like I do that.
Well, I wear hearing aids and they're really, really expensive.
They are.
You can't even, I wouldn't even tell you what I paid for them. But if you could get AirPods and they're like hearing aids, that's definitely worth it. And it makes, I got hearing aids because when I was in the hospital, the nurses would be waving to me because they knew I couldn't hear anything and they'd have to pull me in to be this close so they could explain to me what the problem was. So yeah, hearing is an issue for people with sickle cell disease. And it happens so slowly that you don't really understand it or you don't really appreciate it. But if people are like coming up in your face to talk to you or talking into this ear all the time, then maybe you need to have a hearing test.
Yeah, everybody around me is so tired of me saying what. So I'll probably go ahead and grab some Apple.
And it actually, if you're hard of hearing, it actually affects you globally. People who are hard of hearing, don't get hearing aids or some kind of, then mentally, it isn't good for you to do that because you're really not interacting with people. You're not getting sound. It's it's important if you have a hearing loss to get hearing aids so you can communicate with people.
Yeah, that's true. Maybe I'll think about a hearing aid, maybe.
I'm just going to how do I prepare for college? I struggle with attendance and constantly playing catch up with my classes. That's another, if you had an IEP from when you were a kid, or if you could get an IEP or go to the student health center, you probably could get more time on tests. You could turn in your stuff late, whatever. It is sickle cell is a disability, and if you're in college or wherever you are, you need accommodation. I mean, what are you going to do if you have to go to the emergency room on the day of a test? And it could happen because you're totally stressed out, you're not drinking like you're supposed to, and you end up in the ED. So you have to prepare for those things ahead of time. And in the education, individual educational plan is what you need, and hopefully they'll help you out.
Yeah, I just want to share, when I was in college, I was in a student disability, I think it was called.
Right.
And so a lot of these professors, the attendance was really big back when I was in college, and a lot of these professors, obviously I was sick, and their solution would be like, hey, how about you just try and retake the class next semester? I was like, oh, hell no, 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 no. Just give me the final. And so like I worked with student disability, and they helped me with a lot of these professors because they will be quick to say, just retake the class. And that just means I'm going to be in college for like 5 more years, you know? And so I contested that, and they allowed me to take the final, even though I missed classes. And I got A's on those finals. So they would have otherwise failed me because of attendance rather than because of, like, you know, content of the course. So yeah, definitely use those services to your advantage. I sure did, and it saved me from having to retake classes. You guys, these are such good questions. I love the discourse happening here, but we gotta wrap up like soon. Let's see here. Dr. Q, is there any, you can get compression socks from anywhere. Walgreens, CVS, Amazon. I like to get the copper ones because I'm kind of a germaphobe, and copper has like the antibacterial properties.
Make sure
And
they fit though. Don't get them too tight.
yeah, because I have had compression shocks that have caused crisis. So it really does, you do have to take the time to read about compression socks and make sure you're getting something that actually is helpful and not harmful, because it can also pool blood in a certain way too. And like, yeah. Somebody was asking, someone said the bedazzle it, it'll be cutesy, very stylish, very demure. Not for me. My aesthetic doesn't do hearing aids. Yeah, you guys, I'm vain, don't mind me. How is my pregnancy? That's the question I just keep seeing. So my pregnancy was good. I would put myself in the, you know, probably the minority camp when it comes to sickle cell and pregnancy, but it really is based off of your health history. You guys will hear me say this a lot. I didn't really get sick often. I didn't really get hospital. I probably get hospitalized once after a certain point, right? After a certain point, I would get hospitalized once every 5 years. And I really wouldn't see a hematologist. I would just kind of just be doing my thing. And being okay, not really having too much pain or whatever. So I didn't expect my pregnancy to be any different in a way. And my pregnancy went pretty well. I think I only got one transfusion for throughout the whole pregnancy. Towards the end, I did develop preeclampsia, and I feel like that's kind of like standard within sickle cell at this point. My sister also had developed preeclampsia, and so what they do is they induce you at 37 weeks. So I was induced at 37 weeks. Towards the end of the pregnancy, because all sickle cell pregnancies are considered high risk pregnancy. So I had an OBGYN, I had a perinatologist, and then I worked with my hematologist as well, and then my primary care. So I had a team. I had a team. And towards the end, they wanted me to come in to do the screening, like where, you know, the baby's heartbeat and all of that, probably on a daily basis towards the end or towards closer to the 37 weeks. And so that was my pregnancy. My sister, she also has SS. She has 3 kids. She didn't have a fun pregnancy. She was in the hospital a lot. She got transfused a lot. She had to deal with a lot of like pain and, you know, pain and pregnancy. That's a complex situation, especially if you're looking for pain relief and you know, need some sort of opioids or whatever. It's between, you know, mom and baby and who's staying safe, and do we, you know, give this opioid because, you know, mom is in pain, but, you know, baby's there. And so it gets a little bit tricky. So that was my experience with my pregnancy. I had a vaginal birth. I'm sorry if that's TMI. And yeah, everything, my daughter is healthy. She has sickle cell trait because I have SS, and so all my kids would always have sickle cell trait, and my husband, he's AA, so all my kids would have sickle cell trait, and she does good. She's 10 years old. I have a 10-year-old. And she's like starting to like, I don't know, be kind of like a teenager in a way. It's weird, guys. It's weird. Anyways, that was my pregnancy. I'm going to take one more question and we will wrap up. So if anybody has a burning question or, you know, something that I just missed because like this was great, the live was great. Please go ahead and feel free to ask the next question. I see I am going to, oh, there it is. Please talk about sickle cell trait. I knew I was missing something. Please talk about sickle cell trait, biochemistry of trait complications. Should you see a hematologist? That's a good question.
Yeah, so, okay, so there's sickle cell trait, as you know, you have hemoglobin A and hemoglobin S. So it's not 50-50 because the A is more stable. Usually it's 60-40 or something like that. And people used to say that people with sickle cell trait, it wasn't a disease. Well, I think people still say it's not a disease, but they used to say there was, you know, it was kind of benign. Well, it's not really benign. Sickle cell, people with sickle cell trait have a higher incidence of kidney disease as they grow older. If they have some kind of surgery, even if it's not major surgery, they have an increased incidence of blood clots, and that some of those can be in the lungs, called pulmonary emboli, and that's somewhat increased in people with sickle cell trait. You can't, the thing that people talk about is rhabdomyolysis, or be not getting enough hydration, exercising really hard, and ending up having sickling because you do have sickle hemoglobin, and you end up having renal failure And many people, a lot of athletes usually have died from this rhabdomyolysis. And you don't have to be like a football player. You know, I've read about one girl who was on a basketball team.
Yeah.
I guess she just didn't feel good and laid down, and she died because she had sickle cell trait and she had rhabdomyolysis. So that's the biggest thing that can happen. You don't have an increased incidence of stroke or neurological problems if you have sickle cell trait. What I'm trying to think, so kidneys, you can sickle probably under really extreme conditions, like even if you're on an airplane and you lose that could maybe make you uncomfortable. But the other thing is, a lot of people, at least I hear people say, well, I have a lot of pain and I have sickle cell trait. So what you have to be sure is, do you really have sickle cell trait? And it depends on where the testing was done. Like in California, we have newborn screening. Well, every state in the union has, in the United States, has newborn screening, and they use pretty sophisticated it's called high performance liquid chromatography. They have a pretty sophisticated way of determining whether you have trait, but I have definitely seen children who people thought had trait, but actually had S beta plus thalassemia, or even one kid had S beta 0 thalassemia. So it's not foolproof. So if you're really having problems with sickle cell trait, pain especially, you really need to make sure that diagnosis is correct and that you don't have some other diagnosis, now that we can really do gene testing to see whether you're at risk for something else, to make sure you don't have another diagnosis on top of sickle cell trait. Just because you have sickle cell disease or sickle cell trait doesn't mean you can't have another disease. So you've got to be sure that what you have is correct. And a lot of things just aren't tested for, but that should happen. In terms of how should I take care of myself, I think everything we talked about, diet, all that kind of stuff, is really important if you have trait or sickle cell disease. You really need to stay well hydrated if you have sickle cell trait. I don't know if airlines think that that's a issue in terms of getting, like what Cassandra is saying, getting a special seat and all that kind of stuff, but it could be. It doesn't actually, in terms of education and stuff like that, there shouldn't be any problems, but that doesn't mean you shouldn't have an IEP, because a lot of kids without sickle cell disease have IEPs. It's common to get an IEP if you're in school. And then that follows you through your education, and you can always have accommodations. Kidney disease, there are medical problems that go with trait, but they usually happen as you get to be older. And the healthier you are overall, the better your sickle cell trait will be. It won't be as complicated. But again, just like sickle cell disease, there are other genes that nobody really knows what they are, but siblings like Cassandra and her sister can have totally different presentations of their sickle cell disease, even though they're siblings with the same parents. So you would think there can't be that much difference. They got the same parents, they both have SS. Why are they different? Nobody knows. There are some people now that we can, with the gene work that we can do now, there are people looking at trying to find out what are the things that make siblings different when they're full siblings. So that's
So there are
It's,
there's triggers for sickle cell
oh,
trait.
oh, sure.
Some
Yeah,
of the triggers are high elevation, so any situation with low oxygen,
right.
overexertion, please. And this is something I obsess with my daughter. If it's hot outside and she has recess or is doing anything kind of physical, and make sure she's drinking lots of water. I put this on my getting to know you like with the student. I say I put sickle cell trait on there for my daughter, and people might think I'm crazy. I'm like, please don't let her overexert, please don't let her do these things, because there are stories out there of people just passing away on the spot because they're dehydrated and overexerted and it's too hot out there. So it's important to know what triggers are for sickle cell trait. I always like to say my general rule, I guess, of thumb is, do complications happen to people with sickle cell trait? Yes, but they're rare, or they're more rare. But that's not to say that they don't happen. So should you feel that you have sickle cell trait on a daily basis? Probably not. And Dr. Q will correct me if I'm wrong. I have half of my siblings have sickle cell trait, and I think the one thing I notice is they do drink a lot of water and then they sleep a lot. But other than that, they have completely typical life, and don't have to necessarily worry about it, but it doesn't mean it can't happen. So complications aren't common, but they do happen. I also like to, if there's one piece of advice that from what I've learned is, follow your kidney health, especially with sickle cell trait. And so I know some people with sickle cell trait, and these are people who have had symptoms get labs surrounding their kidney just to make sure kidney function looks good, and drink lots and lots of water. So it's not just us with sickle cell disease that need to drink lots of water. You with trait need to drink lots of water too. But yes, and then I believe also the last thing I'll say about this, 23andMe just published a paper, and I forget what medical journal it is, but just published a paper about complications associated with sickle cell trait. I think there's blood clots. Don't quote me on this. You guys have to go and look this up. But Google 23andMe sickle cell trait, and and a journal article might come up about that, and you can read more about it. I think we'll try and feature that information as well, hopefully within the upcoming weeks.
And one of the things about sickle cell trait and dehydration is you don't have a low hemoglobin. So people with SS, or not so much SC, but with SS, they have anemia all the time, so they can't really exert themselves, and they know they have sickle cell disease, so they drink a lot. If you have sickle cell trait, I mean, there are athletes that have sickle cell trait, so
Yeah.
you're not inhibited physiologically because you have sickle cell trait. It's only under certain circumstances, like dehydration and altitude, that's going to get you into trouble. And I can't remember the name of the football player, but he actually had a splenic sequestration in Denver and had to have taken out of the game and had to have surgery. And that was because he was probably dehydrated at a high altitude and had sickling in his spleen, because there are certain organs in your body that don't have, they're not oxygenated as much as other parts of your body. And your kidneys are one, your spleen is another one, and you have to just really be cognizant of the fact that, well, I have sickle cell trait, but I may feel fine, it may be hot, but I'm going to go on this run anyway. And you didn't bring water and you didn't want to stop running, bad decision.
Yeah.
So you really need to drink a lot, be well hydrated all the time if you're doing any kind of sports, anything, basketball, maybe not ping pong, but But
You
even
never
ping
know.
pong, I've watched them play ping pong. They should be drinking if you've got sickle cell trait.
Okay, very, very last question. You guys, one more question and then we're cutting it off. My liver bilirubin level keeps coming back high. Why is this?
The what keeps coming back high?
Liver bilirubin levels keep coming back high.
Yeah.
Why
Well,
is
that's
this?
because probably, I'm just guessing, but probably you have anemia. Your hemoglobin's probably low. You may even have jaundice. Your eyes might look a little bit yellow sometimes. And your bilirubin, and there's also something called, this is a disease that you can have even if you have sickle cell. There's something called Gilbert's disease, and the reason why I know about it is because I have it. And so if I get really dehydrated or stressed out running or whatever, my eyes can get a little bit yellow because I don't,
Really?
yeah, because I don't metabolize bilirubin the way I should.
You guys, that's empathy right there. That's he's called it a disease, but that's empathy. That's Dr. Q's way of empathizing with people with sickle cell.
So if you have high bilirubin, there's a lot of reasons to have it, but one of them could be that you're hemolyzing a lot, and so that's your bilirubin goes up, and that's why your eyes turn yellow when you have sickle cell disease. But anything that's wrong like that, like a high bilirubin, little things, you really need to check it out, because there's so many other things that it's so easy for a doctor who takes care of people with sickle cell disease to blow it off like I just did and say, oh, well, your hemoglobin's probably low, you're hemolyzing a lot, and so that's why your bilirubin's high. Well, that could be totally wrong unless you've looked at other reasons why someone's bilirubin could be high, and then you rule all those things out, and you have to do that with sickle cell, and then you can say, oh, that's your sickle cell, blah, blah, blah. But that can't be your reflex. You can't just blame everything that happens to somebody medically on their sickle cell, because it could be something more serious, that they have another medical problem, that, liver disease, maybe you have some other kind of liver problem that is causing that. And if no one's ever looked into it, then they don't know, because they never looked into it. And it depends on how high your bilirubin is as well. But yeah, never, bug your doctor if you have an abnormal test. Make sure that they're getting all the information to know that it's okay. It's just your sickle cell.
Dr. Q, what's the name of the condition that you mentioned again?
Gilbert's disease.
Gilbert's?
Yeah, Gilbert's. It's like French.
Gilbert.
Yeah.
Okay.
I'm not
Gilbert's
French,
disease.
so I use
I don't know. I've never heard of
anyway,
it.
it's a enzyme that is supposed to break down your bilirubin, and mine doesn't. And the reason why I found out was I was taking a physiology course, and we all had to do our own urinalysis, and mine had a really high bilirubin. So
okay, it's Joubert.
Something like that, yeah.
Gilbert.
Yeah.
I think.
Disease. It's called a disease. It's not really a disease. We had a kid who had thalassemia who had Gilbert's disease, and he always had a really high bilirubin. And we always thought he was hemolyzing or something was going on with him. And finally, I can't remember who ordered the test, but somebody ordered the test, and we discovered he had Gilbert's disease.
All right, guys, we have to wrap up. Thank you all so much for joining our live today. Such good conversation, really, really great questions. I really love talking to you all. I will let Dr. Q, thank you guys for spelling that. I will let Dr. Q say his special tagline, disclaimer, and then we'll wrap out.
Okay, so as a disclaimer, I don't know anything about the people who are asking these questions. I don't know your medical history. I don't know anything, your lab work, nothing. So basically, I'm just giving you my opinion. Other doctors may disagree with me. I'm not trying to diagnose anything. I'm not trying to advocate for any kind of special medical treatment. I'm just here I try to answer my questions as an information only type of answer without trying to look at you personally to figure out what could be causing your problem. So it's just for Sickle Cell 101 is for information, and that's what I'm trying to give you, information. And I really appreciate all your questions. You make my brain work and keep me young.
That's right.
So, and we love to do this program. It's a lot of fun.
Yeah. And okay, I see still some questions coming in. If you guys didn't get your question answered, please
yes,
email them at ask@sc101.org, and Dr. Q will send you like it's an amazing response, guys. You guys have to see it for you. Just send a question just to see what the responses are like. They're top tier, high quality responses. So ask@sc101.org if we didn't answer your questions. I also want to call out the hippie mom, Demi Law. I forget what it was, or I can't see it anymore. It starts with we. You guys started the live with us and you're still here. Thank you guys so much. That means a lot. That means a lot. A lot of people come in, ask a question and leave. So thank you so much. And like I said, please feel free to send in a question that you have that didn't get answered. We try and get to all of them, and that unfortunately we can't get to everything, but we're still here, just offline. All right. Well, thank you guys. Have a wonderful, restful weekend ahead. It's Friday. We Breeze. Thank you. Thank you. Thank you so much for being here.
First and third Fridays, 10 o'clock.
Yes.
Pacific Standard Time.
Yes, please send your questions over, ask@sc101, and thank you guys so much. Have a wonderful, wonderful weekend ahead. We'll be back in 2 weeks. All right.
Bye-bye, everybody. Thank you for joining us.
Bye.